went from the bonnet, found face down on the floor.
2, 3.
Pediatric trauma.
It's a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell. I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how can I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
Pleasure as always. See you later, Rachel. What's wrong, Joe? How do I spell my surname? D-U. Yep. Hyphen. Capital P. R-A-T. Circumflex over the A, so you don't pronounce T, so it's not Duprat, it is indeed Duprat.
Is it,
French.
Oh, French? Why did I think Dutch?
I am really French, me.
Who's your second team there? Des is running it?
No, that's not a trauma.
Oh, I thought you had someone falling down the stairs.
Yeah, they're coming in there.
Right. Oh, he's my man. Is he
Yeah.
again?
Hello. Great. We have two.
Today, A&E is being run by Graeme and Emma. They first worked together nearly 10 years ago.
Hopefully this guy isn't too bad. I can make a management plan. Stabbed himself in the left side of the chest, and this guy's just fallen down the stairs and got a bit of numbness.
There's a heart somewhere in there. Yeah.
I was going to put a ultrasound on it and see if it was still flippity-floppeting.
I'll come back in a sec.
Graeme and I go back a long way. He's a great colleague. He's a great person to work with. On that day, I was on for trauma, and Graeme was on for the emergency department. Sometimes it's very easy to divide between the trauma role and the ED role, especially when there isn't that much work, because you've got enough people in the team to do it. It's when it gets busy, when you've got maybe 3 or 4 people who've been pulled out of the same car crash. It's about who's the sickest patient, and all the attention gets put onto them until they're sorted.
We'll confirm we've got no pulse then. Carry on with your CPR, hard.
People think that the stress is about the patient that comes in with a cardiac arrest, because they're obviously as sick as they possibly can be. But that's actually one of the more simple things that we do, because then everyone knows what needs to be done, and you go ahead and do it.
Keep going. Have you got a pulse? Yes?
I find trauma tricky because you get completely well people that undergo some pretty horrific forces, and you can go a little way to predicting what those injuries might be, but then you get caught out there as well, and anything can happen, basically, and you'll get someone that looks remarkably stable and something's brewing, and they can become really unwell really quickly. Hello, resus. Yep. Stab. 8 minutes. Lovely.
Adult trauma, ET 8 minutes, and adult trauma.
An elderly man is being brought to resus. 75-year-old pensioner Graeme lives alone on a large London housing estate and has a history of schizophrenia. He's been stabbed in the neck with a pair of scissors during an attempted burglary at his home.
Right, guys. Let's raise his head. It will help with venous bleeding. Keep going. Keep going. Right, he's got a wound that's 1 centimetre long that's just in front of sternocleidomastoid. Anna, would you check him for other injuries, please?
He does.
What was the circumstances of
Someone rang the doorbell, and when he went to the door, the person stabbed him. Stranger. Tragic.
Wow, okay.
I remember when he came in because it was such a shocking story, and you feel the human response to that, but actually the medical response to that was also very time critical, because obviously being stabbed in the neck, there's so many important structures in your neck. We were checking that the knife hadn't gone down and punctured his lungs, and then we were thinking about bleeding that could squeeze his windpipe, bleeding inside his neck, and then whether any of the blood vessels had been damaged and could cause him to have a stroke. So it was quite complex.
Could you please get a light and look inside those nostrils and check that that blood is coming from within and not coming from without?
Just having a look at your nose, that's all. Yeah, looks fine.
There's no blood inside.
No.
Graeme needs an urgent CT scan to find out if there's been any internal damage to his neck.
Right, guys, we've been called to CT. There we go. Thank you.
While obviously when he arrived we were aware that he was on his own, we were told very early on that he had schizophrenia, but my real priority at that time was to check that this wasn't something that was going to be life-threatening, but at the same time just going that extra bit with supporting him, because he did seem very alone and very vulnerable.
Hospitals give you food if you stay here for a night, like tea and lunch and breakfast?
Yeah, they do.
Where's the doctor?
Seeing other patients.
Oi, okay. Oh, bless you. Don't worry.
Graeme has been scanned to check for any internal injuries. Because of the complex structures of the neck, Emma will wait for an in-depth report from CT before giving Graeme the results.
Just give me a minute. He's just been sick as we've come in the door, bless him.
Hello, King Zany. Yeah. Thanks.
Adult trauma call, 10 minutes. That's adult trauma, 10 minutes.
An elderly woman is on the way to resus. Pat is 89 and also lives on her own. She's been found at the bottom of her stairs.
When you're dealing with an older person who's been injured, obviously you've got lots more complexity to deal with. Your margin for errors are smaller. They don't necessarily have the same reserves of a younger person with a young heart, young lungs, strong bones, and therefore you have to be really meticulous in your assessment.
Right, tell us the story.
Pat, she's 89, found by chance by a visitor at the foot of the stairs. Her only medical history, as far as we're aware, is high cholesterol, high blood pressure. She's got a white stick as well, so very partially sighted, but not blind.
Thank you. Cheers. Right, let's get our log rolled.
Ready, press, roll.
Okay, so, does that hurt there? Okay, does this hurt? That hurt?
Unable to find any obvious physical injuries, Emma's attention turns to Pat's mental state.
Get her some
If a patient is confused after they've had a fall, one of the things that you don't know is whether they were confused to start with, whether they might have had an element of dementia in the background. And now that you've put them in a completely disorientating environment and strapped them down, that could make them more confused, but equally so could a blood clot on their brain. So you've got to be trying to find out what their baseline is. And if you can't find it, you've got to investigate.
Pat's friend and neighbour Angie got a call as soon as she was found and travelled in the ambulance with her.
Angie.
Sorry?
Angie.
Yes.
Yes.
Angie.
Yes, that's right. Yes, yes. How did you get in here then?
I've been here ever since you've been in.
Have you?
I came with you in the ambulance.
Did you?
I did. Didn't you hear the sirens?
No.
Oh, red lights, sirens.
No, I never heard of a thing.
Wrong side of the road, shooting the lights. Oh, it's the first for me, Pat. It was quite a hairy ride, actually. I've never been in an ambulance with the sirens and flashing lights. And a bus came out in front of us. We had to stop quite quickly. She would have thought that would be quite exciting if she was really with it enough, you know?
Right, so we'll hopefully be next for CT.
Can you remember going down the stairs?
No.
No?
No. No, I didn't.
Didn't feel dizzy or anything? I must admit, I thought at first that, you know, she had a bit of damage because her voice was a little bit slurred.
A CT scan will determine whether Pat has sustained any internal injuries.
Ready, steady, roll back.
We've known one another and she's been a neighbour for nearly 30 years. She likes to get on with things. Pat had already retired when I moved here. She was a children's nanny for many years and worked abroad. She has very definite ideas, you know, and if something's not right, you know, she'll say, oh, no, 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 oh, no, no, no. She's quite incredible, really.
OK, well done, Pat. Pictures are all finished.
But you're young compared to me. You're 30, aren't you?
No, that's old, man.
Yeah, I'm 36.
That's not... See, my ship has sailed, man. It's sailed.
Oh, stop it.
Stabbing victim Graeme was diagnosed with schizophrenia in 1968. He's been living alone for the last 17 years.
Let's give you something to lean back against, lovely. There you go. You lean back.
I like being independent. I like going to Trafalgar Square and to the National Gallery. I've also been to the Dulwich Gallery. That's a nice little gallery. I don't want to be like my brother. I don't want to go to an old people's home. That wouldn't suit me at all. I'm more modern than that. I've got my independence, but it's at a terrible price at the moment.
I do need to check the strength in your arms and legs. So I'm going to ask you to squeeze my fingers really hard, try to break them. Go on. And this one. Good man.
I'm the only family, only my brother. He's schizophrenic too. I grew up in Islington. It was a big family, 5 children, and my grandmother lived with us. My grandmother really brought me up most of the time.
Do you have normal feeling in this arm?
I had a very, very close relationship with my nan. She was a beautiful woman, and she taught me to read. My nan was definitely a role model for me.
You okay? Yes, sir. Are you okay? Are you traumatizing?
Yeah, I am traumatizing, but we'll get there.
The results of Pat's CT scan are in, but they don't explain why she collapsed.
Your scan was fine, so you haven't... you're lucky. Well, this is a new experience for you, Pat.
I have to say, I don't wish to have it repeated, thank you.
No, I'm sure, no. If you start walking down the stairs, Pat, instead of trying to run.
I trained during the war to be a nursery nurse. Children are marvellous. They're absolutely incredible.
I've got your tea ready.
Did you never want children yourself?
Well, not being married, certainly not. I mean, I never married because I felt that the people who asked me, they weren't for me. I just said no. They weren't right. Better to do that than make a mistake, as one hears about these days. 5 minutes and they're not, and they want another one, another husband. I think, well, you haven't even tried.
All right, is that better?
I think I've had a very, very interesting life, only because I'm single.
Listen, Pat, hello. I've asked the medical specialist to come down and see you to work out why you've collapsed and why you've ended up on the floor. You may have had a blackout, you see, and that would need to have some tests.
Why? I don't know.
I know. Well, sometimes they can just come out of the blue. All right. I'll get you some blankets.
Okie dokie. One of the things that you come to realise when you've been doing this a couple of years is how many people are alone out there, how many people don't have the comfort of friends and family.
I'm just trying to see if we can see the wound.
Emma now has the full results of Graeme's scan.
Well, can I jump back in, please? Now listen, you're a lucky man, Graeme. I know it's a terrible thing that's happened to you, but the scissors look like they've gone to the back, which isn't quite as dangerous as going to the front.
Yeah.
So it's not gone near your windpipe or anything like that.
Is it coming up?
Yeah, it's coming up. Can't see how ugly you are now. No, joking.
You can see how ugly I am. There's a nice thing to say to me. And I thought I was a handsome fella.
Who used the guy who did it then? Do you know?
No, I don't know who it was. I live on my own. I live in a council flat. The flat is a nice flat. I've got a patio in the front and a balcony at the back. The only trouble is it invites non-welcome visitors.
Done? Now, the reason I'm here is because of the wounds there. I'm just coming to close the wounds.
Stitch them?
Yes.
Oh, joy. Oh, joy.
Okay.
It was a pleasant enough day. I'd been listening to my jukebox. I'd got quite a lot of CDs and quite a lot of concerts on DVD. Cliff Richard and people like that, you know.
Okay. So that's one stitch in each cut. So that's all done.
Thank you.
My pleasure.
As soon as I opened my front door, he pounced on me. And I put up a fight. I hit him a few times. That's probably what upset him. But I wasn't going to be bashed about, you know, and not retaliate. Although now I wish I hadn't retaliated, because he might not have stabbed me.
You're still in your 20s. Are you not?
I'm
Are you in your
technically
30s?
29.
No way, what are you turning?
31.
31? What's that? Your wrinkles?
My finger.
Your wrinkles?
It's true, it's true. But
Is that right? What are the 40s? Are they just the 40s? Are they? The flirty 40s?
30 and the flirty 40.
Okay, dirty 30s, flirty 30s, yeah.
Dirty 30
All right.
and flirty 40.
Awesome. And the 50s? That's just old, isn't it? I turned 43 this year.
What? No way.
Yeah, I'm already starting to think about retirement.
You know what this teaches you, doesn't it? It's a lesson. It's not to touch the cooker, because otherwise you end up sitting in A&E at night time for ages. What were you trying to do when you touched it?
See if it was hot or cold.
Oh, really? I think you know now, don't you?
Mum of 5 Cheryl and her husband Andy have brought their son Dylan to A&E unable to breathe. She has left her other children at home with their big sister.
3 girls and another boy.
Someone the baby?
Yeah. I just think I wanted lots of children. It can be hectic. It's nice. It's better than being lonely and quiet.
There you go.
Oh, wow. That's your fireman Sam one.
They're my life. They are my life. I wouldn't change anything. I wouldn't be without any of them. They mean everything to me.
I think those nebulizers did the trick. Your breathing sounds a lot better, mister. And if you see him struggling in the way he was earlier today, you should bring him back in to see us. We'll just be round the corner, okay? Goodbye, Dylan.
4-year-old Dylan's been diagnosed with croup, a virus that affects the airway. Doctors would like him to stay in for the next few hours for monitoring.
Mom. Daddy.
Hello. Go back to sleep, darling. Isabel's my eldest daughter. She's 15. Initially, I thought she was phoning up to ask how Dylan was. You're joking. And she's like, Mum. I was like, yeah. She goes, Son, I can't breathe.
At home, Cheryl's 9-year-old son, Sana, is now also struggling to breathe.
It wasn't even that a long conversation. I was literally quickly called, hang up, and just tried to get his shoes on and everything, because I was panicking myself, but trying not to show it.
What, really bad? Sana's got it. He can't breathe.
I was really scared, but I was trying not to show it. I didn't want him to be scared.
One of us is going to have to come back and get him. All right, bye. Can't breathe. I just remembered running down the corridor on the truss. I don't think I was thinking about anything on my drive actually, apart from I need to get the sun out.
Playing football, didn't feel any pain at all at the time, but just afterwards just saw that the tip had sort of folded down. Spoke to some doctor friends who said, basically you need to probably get that splintered up properly. You know, there's no pain at all, but I've got to admit, I'm not that happy with it.
And then your finger's normally straight.
I think so, yeah.
Not some people it's been like that.
No.
So you bend your finger here.
My main concern is my wife, who tells me that she thinks it's disgusting and doesn't want to look at me anymore.
With her youngest son already in A&E with breathing problems, Mum of 5 Cheryl is bringing in her eldest son, who is now also struggling to breathe.
the nurse took him straight into resus. I think that was when I sort of knew he's really not well, because they wouldn't be taking him into resus for no reason. He was in a bad way.
He was really struggling with his breathing, and that's why I kind of was worried, and then was a bit like, what do I do? Do I bring him into peds and get him seen in peds, or do I just take him across to resus? You can only go in what you can see and what you can hear.
Can you give me an ah? We're just going to pop a little mask on your face, OK? We'll get you sorted, won't we? OK, it's all right. Mummy, hold it.
Hello, young man. My name is Alan. I'm one of the doctors here. All right? So just have a quick listen to you. Is he not asthmatic?
Doctors are trying to bring Saneh's breathing under control as quickly as possible, using a powerful combination of medicines.
We've got all these doctors, and they're all doing different things, and they're getting different tubes and putting probes on him. So I was afraid that he was going to stop breathing.
Graeme, because you're very stable, I know you've got pain, but you've not done and it's no serious internal damage at the moment. We want to watch you overnight to make sure you stay well, but you'll go up to our ward shortly.
I'm taking medication for schizophrenia. I couldn't live with it at first. I used to swear at the voices and all that, and go away, you know? It's a terrible affliction to have. Until they get it under control, it's really terrible. I think I was about 27 when that happened. I don't want to be like my brother. With his schizophrenia, it's made him less independent. If I don't take my medication, I get the voices. But it's got side effects. I kick my legs and get the fidgets. The ordinary man in the street tends to write you off, you know? It's not your fault that you've got it, you know? But they seem to blame you for having it, you know?
Graeme has been attacked in his home 3 times in the past 5 years.
Since the stabbing, I don't feel safe at all. I'm trying to get a move. I'm hoping to get a new place, one that's in a quiet area.
We can treat what's brought them in that day. We can try and support them in some of the issues that are facing them at that time, but we can't change their lives.
Just straighten the finger. If you hold it.
This is better than the cocktail stick splint that I made last night.
Oh, yeah.
And I was with my sister last night, because we've just had our first baby, and she was saying, your little boy will never remember you with normal hands again.
Oh, no, it's so scary.
So I've got to sort it out. So. Brilliant. Well, thank you for your help. Yeah. Thanks a lot.
Take
Cheers.
care.
Okay,
Bye-bye.
bye.
"72-year-old Michael is a retired postman. He's been brought into A&E after having a fall at home.
We're looking at his previous mission where he's got disseminated cancer.
From his notes, Graeme discovers that 2 months ago, Michael was diagnosed with lung cancer, which has now begun to spread through his body.
How are you feeling there, Michael?
Right then.
So, you had a fall yesterday, didn't you?
Yeah.
Yeah, okay. And could you get up? No. So did you spend the night on the ground, on the floor? Yeah. Oh, wow. Okay.
Right.
So, how did you raise the alarm?
When I fell, the back door open, and when I could hear there was something called out.
Oh, right, okay. So your flat door is unlocked, and when you heard someone go past, you yelled out. So someone found you today?
Yes.
Oh, wow. So they called the ambulance for you, did they?
Yeah.
Okay. Gee, I mean, you're lucky, huh? Hey, listen up. Just before you go on, your mouth is so dry. Do you want a sip of water?
Yes, please. There's a bottle there.
Sorry?
A bottle in there.
Yeah.
You can read it. That's it.
This one?
Yeah.
You've got a whole bunch of medicines in there.
Yeah,
Oh, and you've got that bottle?
Yeah, that's one.
Oh, that's morphine.
Is it?
Yeah. Better not take a swig of that, sir. No.
Staff want to let Michael's family know that he's in hospital. His next of kin is a second cousin.
Hi, is that Joyce? Hi Joyce, my name's Lucy. I'm staff nurse at King's College Hospital. How are you doing? He just came in a little while ago, came in the ambulance. He's being seen by the doctor now, but it looks like we're going to be keeping him a good while. Are you coming to visit at all, or...?
Yeah, you can't see. I mean...
Fab. All right, Joyce, no problem. Have a good day. Bye now. Bye. She's nice. I spoke to Joyce. She was at home.
Yeah.
She said she was pleased because she'd been a bit worried about you.
Yeah, sure.
I wasn't his closest family, but unfortunately he'd lost touch with his closest family. I really start remembering him when I was sort of 10 plus. He was massive. He was 6'7", and when you first meet him as a child, that is impressive.
So I'll just start with your hand there.
He was a very private man, a very quiet, gentle person who loved his extended family. He would be sitting there having a cup of tea and a biscuit, nodding, smiling, but not necessarily joining in.
Just looking at a vein in your neck there.
I think if he was born now, he probably will be diagnosed with Asperger's. And his mum was very controlling and wanted to keep Michael. And he had very little chance to escape.
So who's home with you?
Right, nobody.
I don't think he ever had a girlfriend, and he would have made a great husband and a father, with a bossy wife telling him what to do.
Can I get you anything else?
No, it's all right.
OK, I think the doctors are just discussing what the next step is. All right?
Right, yeah.
So you may have got another effusion again and it's infected.
If you want to arrive at a place with a patient where you can help them forward, whichever direction forward might be, you've got to have all the cards on the table. So I want to know what he knows and I want to know what his expectations are. So you've got to have a bit of a dialogue. So, Michael, what understanding do you have of your medical condition?
Well, I've got cancer.
Yeah.
It's not going to go away.
Have you noticed any new symptoms with your breathing at all?
Yeah, it seems to be getting worse.
It has. Over what kind of time frame? Is it something that's happened suddenly over the last couple of days, or is it more kind of a gradual deterioration?
Suddenly, it seems to be getting a bit worse.
It's been getting a bit worse,
Yes.
just in the last few days?
Yeah.
It sounds like what you've been describing to me is, you know, you have kind of gone downhill a little bit because you're less steady on your feet. You're a bit more short of puff than you were. So living alone, you know, adds that extra level of kind of difficulty, doesn't it? You know. Look, today we'll treat what we find as we go and try to get you feeling a bit better. I think we've got a chest X-ray planned for you. I don't know whether working in this environment makes you think a lot more about your own mortality. I find myself often thinking about life and where it's going and what I've got to squeeze out of it. But when you do see people at the end of their lives, I guess you've just got that message nailed home time and time again.
Mum Cheryl now has 2 sons who've arrived separately in A&E with severe breathing difficulties.
I had both of them in my head at the same time. It's like, what one do you stay with? But yeah, it was like really hard. You're just worrying about the pair of them at the same time.
What?
Resus.
Do you mean he's in resus?
As I was coming in, the nurse was coming past me. And that was it. She got him, took him straight into resus.
Okay.
I'm gonna go back round there.
Well, can I come with you?
No, darling.
Why?
Sonny's really, really not well, sweetheart.
Please.
Is that a house?
Okay. You seem a lot better though, don't you? Yeah?
But Mum, I still got a cough.
Yeah, I know.
Where's Mummy going?
To get Santa.
Where's he?
Around the corner.
What corner?
9-year-old Sana's breathing is still not under control. Despite having no history of the condition, doctors think he's suffering a severe asthma attack.
Asthma is a lung condition, and basically the linings of the tubes in the lung become inflamed and irritated and cause spasm in the muscles. Tragically, we've lost 2 asthmatics in the last 3 years, so teenagers.
You all right, Mum? It's okay, he's in the right place. Getting what he needs. Yeah? I know it's been a rough night for everyone, hasn't it? Yeah. Do you wanna take a walk? We'll be here. Yeah, sugar?
Hello. Carl, you're not going to believe what's happened to me. So, Dylan's getting better. He's still in, yeah. I get a phone call from Sybil. Sonny can't breathe. Kyla is in resus. He's on oxygen at the moment now. They're going to stick a line in so that they can give him medicine through the vein and everything. They've already given him 4 nebulizers. And he's not calming down.
Is it a long way?
At the moment, about 2 hours. Yeah. Yeah.
Oh, this is a joke. I'm here now over an hour. How long did she say? It'll be over waiting 2 hours, is it?
Mm-hmm. You'll be here for about 3 or 4 hours, yeah?
Oh, no, it can't be that. It can't be that bad. It can't be that many.
It's all free, you can't complain.
Exactly. There's more sicker patients in here than us.
Well, there's nothing wrong with me.
I don't know about that, Mikey. Oh, stop it. Pain in my stomach, even when I laugh.
After nearly 2 hours in resus, 9-year-old Sana has started breathing more normally. He's well enough to join his younger brother Dylan in pediatrics.
We don't have bunk beds, but you can have beds next to each other.
You're right, Baba.
All I want for him is to have a happy life. To have a happy family, lots of love.
You got matching ones.
He really enjoys playing football. I think that football has given him confidence, the ability to believe in himself. He's coming out of his shell a lot more. I do worry that asthma might have an impact, though. The fear of Sonny having another asthma attack will always be there, regardless of whether he's in primary school, secondary school, or whether he's grown up with his own children. Yeah, I just take every day as it comes.
72-year-old Michael has had a chest X-ray to see to what extent his lung cancer has worsened.
He had a big problem in his right chest, and he had a lot of fluid on that side of his chest, and it just where there should have been a nice big kind of black aerated lung, there was a whole lot of white nastiness in the right side of his chest. And, you know, it's not pretty.
A specialist palliative care nurse is arriving to help manage Michael's treatment and comfort.
We hoped that he would get better and overcome the pneumonia, but I think when I saw him and met him, it became quite obvious to me how sick he was. I've looked after a lot of people who are dying. I've seen a lot of people die. I think people often have a perception like it is in the movies, of somebody just falling to sleep and it's all beautiful. It's not always like that.
I've been talking with the doctors, and obviously you've got a pneumonia on top of an already poor chest, really.
Right.
And what they're trying to do is give you antibiotics to try and address the pneumonia.
Right.
But obviously you're feeling quite poorly even
I
in
know.
spite of them.
I know.
So I think we don't know is the answer, but we're hoping to give you a good run of antibiotics.
Yeah.
But we think we have to take each day as it comes.
Yes. Yes.
Can I just ask, it might be a difficult thing to think about, but obviously you've been having thoughts ruminating in your head. I think if things weren't going the right way and you weren't getting much better,
No. Yeah, right.
we don't really think it would be appropriate to try anything heroic
No.
to bring you back.
No, it's, if it goes wrong, leave it.
Okay.
Let me go.
All right, sweetheart. Okay. All right. I suppose realise that you can only do so much, and if you've made a difference to help somebody die well, then it's been a good day.
Oh, there's a chemical. Hey, cameraman. I hate having my asthma pumps and that. I use the brown one at every morning, and the blue ones when I run out of breath and that.
I'm thankful. I'm here every day. The sun comes out and I look out and I think you're a very lucky person. I do.
He was always a little worry in the background. How's Michael? Have I found him recently? Miss it, yeah. But he will still always be talked about every time there's family gathering. He will be talked about.
I'll remember Michael that he was so brave. He died comfortably. So I'm glad that that happened and that he died well. So yeah, I'll remember that.
you.